Welcome back to Tampa Bay's Morning Blend. Over the past few days, we've been talking about a hashtag not alone TB. Just trying to spread the message that even if you're feeling a little isolated these days, you are not alone. This is, of course, spearheaded by Humana. And I'm so excited to welcome in the Regional Vice President of Health Services, Dr. Albert Zeal, to the show today. Dr. Zeal, how are you this morning?
I'm doing well. Thank you, Natalie. How are you?
I am well. I'm so glad that you're with us today. A big thank you to everything that you're working on in the community and, of course, this project that we've been able to help you with. So let's talk a little bit about the goal of this project. Why did you guys at Humana want to be a part of it?
Well, it's ultimately part of our entire bold goal strategy. And really, the bold goal is to improve the health of the community in 2020 and beyond. This is something we've been committed to for a number of years, especially with addressing the impacts of social isolation and loneliness, not just on seniors, but on the entire community. And one thing I have to point out is that while we've been spearheading this is not something we're doing alone. The key point to making anything successful here in Tampa Bay is to have a collaboration and to work with other organizations and to really make a huge difference together if we can. In my case, I'm the co-chair of our local Bold Goal Community Partnership, and one of our regular meetings, regarding mental health and behavioral health issues and the need to address those is kind of what served as a springboard for us to partner with your station as well as with the Pinellas County National Alliance on Mental Health, or NAMI, to help sponsor the Far From Alone campaign locally. And right now, I'm sorry.
Oh, no, please finish.
Now, as I say, right now, especially in the midst of the pandemic, we know that a lot of folks are experiencing loneliness and social isolation for the first time. And while for many of these individuals, it will hopefully just be a temporary thing, we know that the reality for a lot of folks, especially older adults, it's going to continue when we get to the other side of the pandemic as well. So the key aspect is when it comes to loneliness and social isolation is not only does it even from a physical standpoint, it can impact the immune system and the ability to fight infection, as well as what it does from a behavioral health standpoint.
I'm glad you brought up people who haven't necessarily had that diagnosis in the past. They're starting to have symptoms or starting to have feelings maybe they're not used to before. And so again, that's where this message comes in. But if you're not necessarily feeling it within your four walls, maybe you have elderly parents or an isolated neighbor. What advice do you have for people in our day-to-day life just to kind of help everybody as a community?
Well, it's an interesting question, and certainly one that we've wrestled with as well. In fact, we recognized that this was something that we had to address early on, and when the various stay-at-home orders were placed, we redeployed a lot of our staff to make sure that we were making outbound calls and outreaches to people to make sure that they felt that they were still connected in a good part of the community. So in that regard, we've checked in with members. I'll even share with you that there are some people that haven't had a phone call in weeks, and as our nurses reached out to them and spoke with them, they were able to really make an impact. One story I'd like to share is one of our nurses reached out to someone and found out that he was feeling depressed and anxious, and even was about to run out of a lot of his medications. And she was able to connect with him. They discussed a lot of things they had in common, some of their common book genres that they liked, as well as the fact of where he could get some support through the Friends line and through MD Live, and it really made a difference to him and was able to kind of keep him going a little further. In terms of if you have someone that a loved one or a relative that you're concerned about, my first recommendation would be to certainly reach out to the primary care physician, because certainly he or she knows that individual well and can help provide some good advice on what needs to be done to really meet those needs. And in addition, it's stay in contact, certainly reach out telephonically, write a letter if they're not necessarily close by, or an email, certainly, and be happy to share those Far From Alone resources. They can certainly be quite valuable in terms of what people need right now.
Dr. Zeal, thank you so much again for talking about this. I think it's so important. It's such a message that we can't say enough. Hopefully you have a good day. We look forward to staying in touch with you. And again, you just touched on that hashtag one more. There's another one. There's also a website too. Share stories, maybe perhaps share a smile. Thank you again. And I hope you stay right there, folks at home, because we're going to be right back.